licensed clinical professional counselor, and today I want to talk to you about trauma bonding. So I first want to tell you a little bit about what trauma bonding is. Trauma bonding can occur between a person and their abuser. So maybe a child and the child abuser or molester, a hostage and their kidnapper, or even a cult leader and their followers. Trauma bonding is similar to Stockholm Syndrome, in which there's a deep emotional connection between the victim and the abuser. Trauma bonding occurs as a result of ongoing cycles of abuse. The trauma of abuse can result in powerful and overwhelming feelings that are alternated with kindness and intimacy. Typically, what occurs in these cycles are there's abuse, and then there's apologies, there's promises to change, excuses such as I was upset. So following abuse, there's apologies, there's promises, there's excuses. And that's how this cycle occurs. Since the victim has experienced kindness from the abuser in the past, they believe the person can change or revert to the person that they once were. Typically, it's manipulation from the beginning. The abusive side of the abuser is often hidden during the early stages of the relationship. They know that the victim has experienced that kindness and intimacy from them, that closeness. So the perpetrator, the abuser, the narcissist is very knowledgeable of their cycle and how to manipulate their victim. They know that they can shower the victim with gifts. They can take them out on dates. They can tell them how great they are, acknowledge them, accept them, approve of them. And then once the victim starts to trust them again, the cycle starts over. There's more abuse. Very often in this cycle of abuse, love overshadows the fear of continued abuse. A person that's never been in an abusive relationship has a difficult time understanding how someone could love someone that abuses them to the extent that they do, and that love overshadows the fear of ongoing or continued abuse. Some of the signs of trauma bonding are being unhappy but unable to leave, protecting their abuser by keeping their abuse a secret, making excuses for the abuser's behavior, blaming themselves for the abuse, fixating on the good days that they've had as proof that the relationship is good or the person is good or that they actually love them. The role that dopamine plays in the brain for someone who struggles with addiction is very similar to the role dopamine plays in the brain of someone who suffers from or struggles with trauma bonding. Dopamine creates feelings of pleasure, so it can strengthen the connection between the abused and the abuser. Very often the victim or the codependent tries very hard to earn the affection of the narcissist or the abuser that they are in a relationship with. They often try earning their affection and approval. So how do you break this bond? How do you break this trauma bond? Well, first, being able to identify that there is a trauma bond is very important. Most people don't realize that that's what they're dealing with. Childhood trauma puts a person at a higher risk than the average individual for being in a trauma bonding situation. The brain remembers the highs and lows of the abusive cycle from childhood. It's familiar. It's very important that the victim of abuse talks to their loved ones about what they're experiencing at home or at work or wherever the abuse is occurring, so they're no longer protecting the abuser or their abusive behavior. They're no longer keeping the secrets. So no more secrets. The worst thing you can do is find yourself alone in a home with an abusive person and no one knows that you are. That perpetuates the cycle. Journaling is a very helpful and effective tool in breaking the trauma bond. Journaling can help you to identify or establish unhealthy, toxic, and dysfunctional patterns. During your journaling experience, it's very important to document what occurred prior to the abuse, during the abuse, and after the abuse. It's important that you're able to identify whether there are patterns that occur prior to or that triggers the abusive behavior, what the unhealthy behaviors are during the cycle of abuse, and then after the abuse occurs, what happens? Are there apologies? Are there gifts? What is happening before, during, and after? Please journal about that process, about the cycle of abuse. This is very helpful in your recovery and in your getting to a safe place. A therapist can help you to strengthen skills such as journaling and other healthy coping skills that might help you to deal with or manage your thoughts, feelings, and emotions in this process and develop a safety plan. Very often the individual that's perpetuating this cycle of abuse and inflicting harm upon someone that they know loves them is a narcissist. They typically have symptoms, signs of a person with narcissistic personality disorder. It's very important that you remember that abuse is never your fault. Sure, you may not be perfect. Sure, I'm sure you make mistakes. However, it's never the abused person's fault. There's never a reason for someone to abuse another human being. It doesn't matter what the behavior of the victim consisted of. When a victim believes they are the reason or they are at fault or to blame for the abuse, it is much more difficult for them to leave the abusive relationship. This is another reason why it's very important to get connected with a licensed clinician so that someone that's skilled and experienced in helping individuals identify these dysfunctional patterns of thinking and behaving. It's really important that if you're going to leave a trauma bonding situation, that you cut the perpetrator or the narcissist off completely. Block their phone number, block them from social media. In some cases, getting an entire new social media account or phone number is necessary depending on the extent of the abuse. It's very difficult initially once you decide to cut communication completely off from the abuser, because that's when they start to do one of two things. They start to threaten, intimidate, and sometimes they might stalk you. So it's important that you secure a support system and you have a support system of individuals that know what's going on and they are prepared to help you through the process and through the change. I call it the detoxification process. You're detoxifying from the toxicity that existed in that relationship, the codependency that you had during that time that you were with that very abusive and narcissistic person. The other thing that the abuser might do once you have completely cut off communication is make promises. They start to promise to change, they can't live without you. Sometimes they threaten to harm themselves if you don't take them back. Just remember, you are not responsible for their behavior, whether it's harmful behavior towards you or towards them. Also, remember how many times they made promises in the past and how many times you believed them and it didn't happen. And if you've already cut off communication, you are one step closer to being in a safe place, in a healthy place. So going back kind of puts you in a place in which you're starting from square one. So The most important things I want you to remember is that during that cycle of abuse, a narcissist will revert back to or go back to the early stages of courtship to win their victim back. Shower you with gifts, take you out, and make promises and give you compliments and do everything that they know to do to make you feel loved and accepted. Once that trust comes back, once you start to trust them, once the victim starts to trust the abuser again, and they're feeling good, they're feeling connected with all the kindness and the intimacy that's going on, that is setting the stage for the next cycle of abuse. These cycles are typically intermittent and they're ongoing. The more the codependent victim reaches out for love, for help, for approval from their narcissist abuser, the more that trauma bond is strengthened. Getting professional help can help you figure out what is or was fueling the trauma bond, learn healthier coping skills and skills for rebuilding confidence, self-esteem, and quality of life, address any issues with self-criticism and self-blame that may be hindering the process of breaking the trauma bond. And as I mentioned earlier, developing a safety plan and a self-care plan. My number is 618-717-2732. Myself or one of my colleagues will be happy to help you. Please visit KarmaBrownCounseling.com for any questions or call the office for an appointment. Thanks and have a great day.